Our first question is from Tony Mendez of Poder 102 FM. What is your team's action plan to improve Latinos' chances against COVID-19, given that almost 50% of the positive cases in Rhode Island are Latinos?
A lot of work needs to be done with this. We have a team that's focused within our testing work stream on being able to set up testing sites throughout our communities with the particular focus on our Latino communities and other racial and ethnic communities of color. We have testing sites that will be rolled out, as I mentioned, accessible for people who can walk to them and be able to access them more easily than some of the additional sites that were originally started. And many of the outreach efforts that I discussed earlier. We want to make sure we're engaging with our faith-based communities. We want to continue to leverage our health equity zones, infrastructure, and the tremendous amount of work that's being done through Rose Jones and the team that the governor had shared previously in helping to make sure that access to food is present, access to other social services, and we want to continue to carry on the conversation so that we can respond. Many of us have talked about the fact that it is addressing the conditions that people are living in: housing, education, transportation access, access to fresh fruits and vegetables. When we have those better established, those structures in place across the board, regardless of the zip code, then we will start to see improvements in the types of numbers and the disparities that we're seeing with COVID and many other diseases and entities. So this is going to continue to be a partnership, and we stand ready to engage and respond to what we absolutely should be doing to make sure that our Latino population, as well as others, have what they need to get through this as well.
Thank you. I will just add that obviously this is something that's very concerning and we are very focused on. We're trying to figure it out. We're trying to figure out why and what we can do to improve the results. In fact, we'll be spending a good bit of time this weekend really trying to understand it. I will say to members of the Latino community and everybody, please obey the social distancing guidelines. And that even means within your families. So it's very important, as we've been saying, 6 feet apart, no more than 5 people together, no big group gatherings, no gathering in churches. It's difficult, but we know that it works and it will prevent more people from getting sick. So we'll have more to say about this in the coming days as we try to unpack it and figure out what more we can do. And in the meantime, my message to the community is really hunker down and take the stay-at-home order seriously to protect yourselves and your families.
Kathy Gregg from the Providence Journal is next. She notes that on Thursday, the state closed a single DHS office with 100 employees and placed 60 on quarantine because of a single COVID case. She asks, when do you close other state offices, order those workers who can to work from home, and furlough the rest to save money and protect the workers?
We have what are called continuity of operations plans, COOPS plans, which we actually worked on for years. And so the Rhode Island Department of Emergency Management makes all the directors submit their plans, revise them regularly. This is part of what Rhode Island does to be prepared in general to all kinds of crises. When the COVID-19 crisis outbreak happened, we revised and updated all of our continuity of operations plans, and so we have office closure plans in place for all state facilities so that we're prepared when an instance like this happened up at the DHS office in Pawtucket. The nature of that office and in the employee necessitated that we send everyone else home in an abundance of caution and, frankly, to protect our employees while the Department of Health does their contact tracing program. But we have been working closely with them and felt well prepared to be able to pull the trigger on that plan. We have been working aggressively on telework to get more state employees working from home. We have over 2,000 employees who now have telework plans in place. Since the crisis started, we've deployed almost 700 new devices in order to enable people to work from home. We even have people doing virtual call center responsibilities from home so that they can help process things like unemployment claims and DHS payments, all from the safety of their home. And so we have been rapidly expanding the technology deployment in order to enable state workers to stay protective and stay safe. And then the final piece, the furlough question, which has come up many, many times. And the answer is the same, which is that that's the last thing that we want to do, although we do need to be clear that the condition of the state budget is extraordinarily difficult. State revenues have fallen dramatically, and we've got some really tough choices ahead. And so for now, as we can continue to get cooperation and flexibility from our workforce, where they're willing to go help out in other places where the need is the most, to be able to meet Rhode Islanders' needs at some of their most vulnerable moments, then we'll be able to keep all of our employees productive and push off the conversation about furloughs, because that's not what we want to do, and we hope it's something we don't have to do.
Thank you.
Thank you, Brett. That was excellent. I do want to underscore that point about furloughs. Furloughs aren't off the table. The revenue, as Director Smiley said, is, like in every state, really depressed right now. And our casino has been closed for over a month, third largest source of revenue. So it is my strong goal and direction and guidance to avoid furloughs, but at this point I can't rule anything out. Nothing's off the table. And as Brett said, our ability to avoid furloughs depends upon our workforce continuing to be flexible and understanding as they have been, and it's our hope that we'll work collaboratively with them in order to keep everybody employed as long as possible. Because the last thing I want to do is to contribute to the state's unemployment rate and to put out of work any state employees who, many of whom have borne a difficult burden as we've dealt with this. So I would say I hope to be able to avoid it, and I'd ask for continued cooperation from state employees and state employee labor unions to work with us in partnership so that we can avoid furloughs.
Brian Amaral of the Providence Journal asks, in regard to the model you released the other day, the projections you've released show the peak for hospital beds. Do you have projections for ventilators? How many will we need at peak, and will we have enough?
I do, Brian. I don't have them at my fingertips, and I don't want to say something wrong, so I will get back to you by the end of the day today. We don't now have enough, to be very honest, but we have a number more on order. And as I've said all along, it is my goal to work for the best and hope that we're not going to see the peaks that I have revealed in the models. And at this point in time, we certainly have enough. We just received 100 from the federal government. We continue to order. So there's absolutely no reason for alarm, but we're still procuring so that if we get up to one of those peaks, we'll be ready when we get there.
Tara Granahan of WPRO Radio says that we've been told distance learning is going well, but a Providence district administrator says statewide 40% are learning, 40% are trying, and 20% are not logging in at all. Your response?
So that is not consistent with the data. The number of folks who are attending is actually much, much higher than the 80% that would suggest. As I'll be the first to say, though, it is not perfect, and it is hard to execute. Rhode Island is doing a better job by any metric than any state in America, and teachers are bending over backwards to be creative. We have gotten to a place where nearly everybody has access to a computer and Wi-Fi so they can work at home. And by the way, it's not just all logging on. It's not all on a computer screen. A lot of it is interactions in another way, picking up packets, doing work, talking to teachers on the phone. So I know that it's better than 80%. It isn't perfect, and frankly, it is getting better, not worse, the longer we do it. So nobody wants to be here. I would love to open the schools on Monday, but we can't, and I think we're muscling through the best we can. And for every bad story, and there are some, and it's imperfect, there are many, many, many good stories of children continuing to learn and actually learning new skills as they go through this experience of distance learning.
Christian Winthrop from Newport Buzz says in the last few days he's heard from many brides seeking guidance for their Newport weddings this summer. When can they expect a definitive set of guidelines regarding capacity limits and new social distancing rules? Essentially, they just want to know if they have to cancel.
Yeah, I just need a little more time on that. I can tell you, if you were planning a very large wedding, it's hard for me to see how that could happen this summer. In the coming weeks, as I said, between now and May 8th, I'll be making many more announcements as it relates to the regulations we'll have by industry, and that will include regulations around the size of crowds, and I'll be in a better position then to give you the details of where I think we might be this summer.
Our next question is from Alan Gerberti of 990 WBOB. Minority communities are affected disproportionately by COVID-19. There are concerns initiatives such as Roadmap Rhode Island will make these outbreaks for people of color more severe and deadly. How will you address this going forward?
Yeah, so I think we talked about that earlier. We are ramping up our efforts right now, first of all, to understand why this is happening. Second of all, we're making a very big push around more testing in communities of color and cities, and essentially we want to bring the testing to where people are so they can walk to the testing. We're also making a bigger effort around mobile testing and working hand in glove with community health organizations to make sure that we are meeting the needs of everybody, and as Dr. Nicole said, making sure nobody in any zip code or of any color or socioeconomic status is left behind. But we're still learning about the disease, and by the way, I should say we're in constant contact with leaders in the community to try to understand it better, because when we can understand it better, we can react to it better.
Abigail Nilsson of the Anchor newspaper says, yesterday you mentioned that college dorms are being considered as a place to quarantine healthcare workers. When would you hope to open the dorms for this? What does it mean for the students living in dorms currently, students who plan to live in the dorms in the fall, and also the return to in-person classes?
Okay, so there's a lot there. If you're living in a dorm, we obviously will not displace you, so you need not worry about that. I would love to be able to have an announcement next week around whether we can make dorms available as a free living arrangement. With respect to whether colleges resume classes in the fall, that's very much an open question right now. I have been in contact with the presidents of certainly of URI, RIC, and CCRI, but also with some of our private colleges and universities. They're all trying to figure it out right now. Can they open in the fall? If so, can students come back into the dorms? Under what set of conditions? Should they push back the fall start into a time that's later? So I don't think anyone is ready to make any of those announcements, and thankfully September is many months away, but I can tell you the wheels are turning every day, trying to figure out can we let the students come back? If so, under what conditions?
The next question is from NBC 10 News News Director, Scott Isaacs. It's been about 3 weeks since concern emerged over people coming to summer homes from New York City. Have your restrictions worked out as you hoped? Are there stats on out-of-staters in Rhode Island who have tested positive? Do they count as Rhode Island cases or New York cases?
Yeah, so there are statistics. I don't have them off the top of my head. If you're tested here as a positive and living here, it counts as a Rhode Island case. So when you see the numbers on the screen, they are included in that. I will say for the most part, yes, it has been very effective and people have been very cooperative. And for the people that we've interacted with, or National Guard or state police has interacted with, by and large, people understand that it's not about preventing people from using their second homes. It's about knowing who is here, helping them to quarantine if they need it, and knowing if they're positive so we can do the contact tracing on them just as we would anybody else.
Amanda Milkovits from the Boston Globe asks, what level of testing does Rhode Island need in order to begin reopening?
Yeah, it's a fantastic question and one that we're trying to figure out right now, and that we will be spending a lot of time on over the next couple of weeks. We know we're doing about 2,000 a day now. We know it will be many more than that. I've also been in touch with many employers, and they are wanting to make sure that their employees can all be tested before they return to work. So I need to figure out a way to ramp up our testing to meet that demand. So I need a couple of weeks on that one. The answer is, multiples of what we're doing today, but I don't know precisely what the answer, I don't know exactly what that number is right now.
Our last question today is from Kelly Johnston of ABC6 News. Will your plan to reopen the Rhode Island economy reflect the guidance announced by the president this week?
Yes, it will. So the guidance put out by the White House was high level. It was high level guidance, not very detailed, but it did say that governors should look to reopen the economy in stages, and that is certainly guidance that we will follow. So the guidance is that you can't think about reopening the economy until you've seen at least 14 days in a row of declining cases, and we know the clock hasn't started there yet because we're still increasing. And then that triggers phase one, kind of a limited reopening with fairly stringent restrictions and social distancing requirements. And then you hit another set of benchmarks and you can go to phase two, which is a broader reopening. And so yes, the short answer is we will be taking an approach like that in stages, incrementally. Each governor is going to necessarily have to go into a lot more detail by industry. And of course we have other decisions around schools and childcare, not just businesses. But overall, I think the guidance was helpful and we'll look to comply with it.